Over-medication, particularly in children, is a growing issue. More than 3.4 million American children are currently taking medication for ADD and ADHD, and yet the numbers continue to rise. President Trump has asked me to reverse the epidemic of chronic disease. The way to do that is to bring HHS to its full potential as the steward of the American healthcare system. That is the mission that I want to share with you. I have a vivid memory of visiting NIH when I was a boy. My mother, a woman who worked for my mother, had a husband who was an NIH scientist. And when I was that age, I wanted to be a scientist. And he would bring me to NIH, to the labs, to look at the rats and the guinea pigs, and to look through the microscopes. And for me, that was an extraordinary thrill to see scientists who were engaged in this existential search for existential truths, and who were working to make our country stronger and to make our people stronger. Those were different times. America was at the apex of its power and prestige, and all the world looked to us for leadership. This was particularly true of NIH and CDC and FDA. They provided the gold standard of science and research, trusted the world over. They produced scientific heroes like Bernice Eddy, Sarah Elizabeth Stewart, and Frances Kelsey. Frances Kelsey was, of course, the young FDA scientist who, through her own stubbornness and integrity, saved our country from the scourge of thalidomide and left a wake of grim birth defects and grotesque mutations and deformities across Europe. In 1962, my uncle John F. Kennedy honored Stewart with the President's Award for Distinguished Federal Civilian Service, the government's highest civilian honor. The greatness of NIH was rooted in its unimpeachable integrity. It truly deserved the reputation for conducting science in the public interest. Countries that didn't have their own research institution, for example, the new countries of post-colonial Africa, trusted American science so much, and many of them wrote into their own laws, if the FDA approved it, then it's approved in our country as well. I want the agencies under HHS to earn that level of global trust.